What if I told you that some of the most subtle, everyday symptoms could signal something as serious as pancreatic cancer? Would you know what to look for? The symptoms of pancreatic cancer often stay hidden until the disease has progressed. But today, we're uncovering 7 critical warning signs that could save a life if caught early. Who is this video for? If you're concerned about your health, know someone with a family history of cancer, or simply want to stay informed, this video is for you. By the end, you'll learn how to spot the red flags, understand the risks, and take actionable steps to protect yourself and your loved ones. This isn't just another theory-based video. We'll walk you through a step-by-step guide on how to respond to these symptoms. If you find value in this video, don't forget to like and share it. It helps others who might benefit from this information. And make sure to subscribe and hit the bell icon for more content that empowers you with knowledge. Now, let's dive into the first symptom: unexplained weight loss. One of the earliest and most noticeable signs of pancreatic cancer is sudden and unexplained weight loss. This alarming symptom often goes unnoticed or is attributed to stress or lifestyle changes, but it can be a critical early warning sign of a serious underlying issue. If someone hasn't changed their diet or exercise routine yet experiences rapid and significant weight loss, it's time to take it seriously. Why does this happen? Pancreatic cancer can disrupt the body's ability to properly absorb nutrients, leading to malnutrition and weight loss. Here's how it happens. The tumor may block or reduce the production of digestive enzymes that are essential for breaking down fats, proteins, and carbohydrates in the small intestine. Without these enzymes, the body struggles to process food, and essential nutrients are lost. This condition, known as exocrine pancreatic insufficiency (EPI), leads to fewer calories being absorbed despite normal or even increased food intake. As a result, the body begins to burn its fat and muscle reserves, causing a noticeable drop in weight. Consider a middle-aged person who has been steadily maintaining their weight for years without fluctuations. Suddenly, they lose 10 to 15 pounds in just a few weeks without making any changes to their diet or physical activity. This weight loss might be dismissed as a result of stress, a busy schedule, or even an improvement in eating habits. However, when combined with other subtle symptoms, such as fatigue or changes in bowel habits, it may signal something far more serious. What to do? If you or someone you know is experiencing sudden and unexplained weight loss, it's important to act quickly. Consult a doctor immediately, share details about the weight loss and any other unusual symptoms, no matter how minor they may seem. Request diagnostic tests. A doctor may recommend blood work, imaging studies such as CT scans or MRIs, and potentially endoscopic evaluations to assess the pancreas. Track your weight regularly. Keep a record of weight changes, as this information can be valuable for doctors in identifying patterns and diagnosing potential issues. Be proactive. Early detection is crucial in managing pancreatic cancer. Discuss any family history of the disease, as well as other risk factors like smoking, obesity, or chronic pancreatitis, to ensure a thorough evaluation. Additional tips: monitor your digestive health for other signs of malabsorption, such as oily or foul-smelling stools, which may indicate fat digestion issues. Maintain a balanced diet to support your overall health, but if weight loss persists, seek medical advice regardless of nutritional intake. Key takeaway: sudden, unexplained weight loss is not just a benign occurrence. It is often the body's way of signaling a serious issue. Pay attention to this symptom and don't delay seeking medical advice. It could save a life. Persistent abdominal pain or discomfort. Have you ever experienced abdominal pain that just doesn't go away, no matter what you try? Persistent pain or discomfort in the upper abdomen, especially when it radiates to the back, is a potential warning sign of pancreatic cancer. While occasional stomach pain is common and often harmless, ongoing pain in this area should not be ignored. Why does this happen? The pancreas is located deep in the abdomen, near vital structures like the stomach, spine, and surrounding nerves. When a tumor develops, it can press against these organs and nerves, causing discomfort or pain. The pain may start as mild or vague, but can gradually worsen as the tumor grows. How it might feel. Imagine someone experiencing a dull, aching pain in their upper abdomen. At first, it may seem like minor indigestion or a pulled muscle. Over time, the the discomfort intensifies, often radiating to the back. The pain may become more pronounced after meals or when lying down, making it harder to ignore. Despite trying over-the-counter remedies, the pain persists, creating frustration and worry. What should you do? Persistent abdominal pain is not something to overlook. Here are some steps to take. Pay attention to patterns. Is the pain worse after meals? Does it linger for days or weeks without relief? Avoid self-diagnosing. While it's easy to assume the pain might be caused by something minor, such as gas, acid reflux, or a pulled muscle, don't dismiss the possibility of something more serious. Seek medical advice. If the pain persists or worsens over time, consult a healthcare provider. Describe your symptoms in detail, including when they occur, how they feel, and what seems to make them better or worse. Discuss advanced imaging. Ask your doctor about imaging options like MRIs, CT scans, or endoscopic ultrasounds to identify any underlying issues. Early detection is key in addressing conditions like pancreatic cancer, so don't hesitate to advocate for further investigation if your symptoms are unexplained. Why persistent pain should never be ignored. Pain is your body's way of signaling that something may be wrong. While abdominal discomfort can have many causes, relentless or worsening pain is never normal. Acting early can make all the difference, especially when it comes to potentially serious conditions like pancreatic cancer. Don't wait for the pain to become unbearable. If you or someone you know experiences persistent abdominal pain, take it seriously and consult a healthcare professional. Early intervention could save a life. Jaundice, yellowing of the skin and eyes. Have you ever looked in the mirror and noticed a yellow tint in your eyes or skin? This alarming change, known as jaundice, is one of the most noticeable and recognizable signs of pancreatic cancer. While it might seem like a cosmetic issue at first, jaundice often points to a more serious underlying condition. Why does this happen? The pancreas is located near the bile duct, a crucial pathway that carries bile from your liver to the intestines to aid in digestion. If a tumor blocks this duct, bile builds up in the bloodstream instead of being released into the intestines. This excess bile causes a yellowish discoloration of the skin and eyes, known as jaundice. Other symptoms that may accompany jaundice include dark urine. Excess bilirubin in the bloodstream is excreted through urine, giving it a darker color. Pale stools. A lack of bile reaching the intestines may cause stools to become light or clay-colored. Severe itching. Bile buildup in the skin can lead to intense, persistent itchiness. How it might present. Imagine a busy professional who begins noticing a slight yellowish tint in their eyes when looking at photos. At first, they assume it's due to bad lighting or tiredness. Over time, their skin also develops a yellow hue, and they begin experiencing unexplained itchiness that becomes increasingly uncomfortable. Despite the changes, they delay seeking help, not realizing these subtle symptoms could indicate a serious internal issue like pancreatic cancer. What should you do? Jaundice should never be ignored, as it can indicate a serious problem within the pancreas, liver, or bile duct. Here's what you should do if you notice these symptoms. Pay attention to changes. Look for yellowing in the whites of your eyes or your skin, as well as associated symptoms like dark urine, pale stools, or itching. Seek medical advice promptly. Contact a doctor immediately if you notice jaundice, particularly if it occurs alongside other concerning symptoms such as abdominal pain, unexplained weight loss, or nausea. Undergo imaging tests. Your doctor may recommend imaging tests such as ultrasounds, CT scans, or MRIs to determine the cause of the jaundice and identify any underlying issues, such as a tumor or blockage in the bile duct. Why jaundice should be taken seriously. While jaundice might initially appear as a skin issue, it's often a sign of deeper problems involving the pancreas, liver, or gallbladder. Acting quickly is critical to identifying the underlying cause and addressing it before the condition progresses. Don't dismiss yellowing of the skin or eyes as a minor concern. If you notice these changes, trust your body's signals and consult a healthcare provider without delay. Early detection can be life-saving. Digestive problems and changes in stool. Have you ever noticed persistent changes in your digestion, such as greasy stools or difficulty digesting fatty foods? While these symptoms may seem minor at first, they could signal an underlying issue with your pancreas that warrants attention. What happens in the body? The pancreas plays a crucial role in digestion by producing enzymes that help break down fats, proteins, and carbohydrates. These enzymes allow your body to absorb nutrients from food. When a tumor or other issue disrupts this process, your body struggles to digest and absorb nutrients effectively. This can lead to significant and noticeable changes in digestion and bowel movements. Key symptoms to watch for. When the pancreas is not functioning properly, you may experience the following symptoms. Oily or greasy stools, known as steatorrhea. This occurs when undigested fat passes through the digestive system, resulting in stools that appear shiny or greasy and are difficult to flush. Foul-smelling stools. Poor fat digestion can cause stools to have an unusually strong or unpleasant odor. Pale or clay-colored stools. If bile is not reaching the intestines due to a blocked bile duct, stools may lose their normal brown color and appear pale or chalky. Frequent diarrhea or inconsistent bowel movements. The lack of digestive enzymes can lead to diarrhea or irregularity in bowel habits. What should you do? Digestive changes like these should not be ignored. Here's how you can take action. Track your symptoms. Pay close attention to persistent digestive problems, especially if they are new or unusual for you. Note any changes in stool color, texture, frequency, or odor, as well as any accompanying symptoms like bloating, abdominal pain, or weight loss. Seek medical advice. Schedule an appointment with a healthcare provider to discuss your symptoms. Be honest about the changes you've noticed, even if they seem minor or embarrassing. Consider diagnostic tests. Your doctor may recommend blood tests to check for pancreatic enzyme levels, stool tests to detect fat malabsorption, or imaging studies such as CT scans or MRIs to examine the pancreas and surrounding organs. Don't delay action. Digestive problems related to pancreatic issues can lead to malnutrition and other complications if left untreated. Early detection and intervention are crucial. Why these symptoms matter? While occasional digestive discomfort is common and often harmless, persistent changes in digestion, particularly greasy stools or pale-colored stools, may signal a problem with the pancreas. These signs could be early indicators of conditions like pancreatic cancer, chronic pancreatitis, or other pancreatic disorders. Ignoring these symptoms can lead to more severe complications, including malnutrition, unintentional weight loss, and a decline in overall health. If you notice any of the changes described, don't brush them off. Instead, consult a healthcare professional to address the underlying cause and get the care you need. Early recognition of digestive changes can make a significant difference in managing pancreatic health and preventing further complications. Trust your body's signals and take action to safeguard your well-being. Persistent nausea and vomiting. Persistent nausea and vomiting. Could it be a warning sign? Nausea and vomiting are common symptoms we all experience occasionally, often due to overeating, stress, or a mild stomach bug. However, when these symptoms persist without a clear cause, they could indicate a more serious health issue, such as pancreatic cancer. Recognizing and addressing these symptoms early can be vital for timely diagnosis and treatment. What happens in the body? The pancreas plays a critical role in digestion by producing enzymes that help break down food. When pancreatic cancer develops, the growing tumor can exert pressure on nearby organs, such as the stomach and small intestine. This pressure may partially block the digestive tract, leading to persistent digestive disturbances. Unlike occasional nausea caused by a heavy meal or anxiety, nausea and vomiting related to pancreatic issues tend to be more severe, consistent, and difficult to alleviate. Key symptoms to watch for. Frequent nausea, a recurring feeling of sickness that may occur after eating, particularly meals high in fat. Vomiting, episodes of vomiting that may worsen over time and occur more frequently. Loss of appetite, a diminished desire to eat, often because of the discomfort associated with meals. Weight loss, unintentional weight loss due to decreased food intake and impaired digestion. Symptoms tied to meals. These symptoms are often more pronounced after eating, especially fatty or heavy meals, as the pancreas struggles to produce the enzymes needed to break down fats. How it might present. Imagine someone who begins to feel nauseous every time they eat, particularly after consuming a rich or fatty meal. At first, they may dismiss it as indigestion or overeating. Over time, the nausea becomes more frequent, sometimes accompanied by vomiting. They start avoiding meals altogether, leading to a noticeable drop in weight and energy. These persistent and worsening symptoms could be an early warning sign of pancreatic cancer interfering with the digestive system. What should you do? If you notice persistent nausea and vomiting, it's essential to take the following steps. Monitor patterns. Pay attention to when the nausea and vomiting occur. Note if these symptoms worsen after meals, particularly those high in fat. Keep track of any associated symptoms, such as loss of appetite or changes in stool. Consult a doctor. Don't dismiss persistent nausea and vomiting as minor issues. Seek medical advice if these symptoms last more than a few days, interfere with daily activities, or lead to weight loss. Diagnostic tests. Your healthcare provider may recommend tests such as blood work, imaging scans, e.g., ultrasound or CT, or an endoscopy to determine the cause of the symptoms. They may also evaluate pancreatic enzyme levels to assess digestive function. Be proactive. Early detection is key in addressing potential pancreatic issues. Even if the cause turns out to be less serious, addressing persistent symptoms can improve your quality of life. Why these symptoms matter. Persistent nausea and vomiting are more than just discomforting. They can be signs that something is seriously affecting your digestive system. If these symptoms are related to pancreatic cancer, they indicate that the tumor may be disrupting normal digestion by pressing against or partially blocking the stomach or small intestine. Ignoring these signs can lead to malnutrition, dehydration, and further complications. While occasional nausea is typically harmless, symptoms that persist, worsen, or occur alongside other issues like weight loss or changes in digestion require medical attention. The bottom line: persistent nausea and vomiting are never just minor inconveniences. Your body uses these symptoms to signal that something may be wrong. Whether it's pancreatic cancer or another condition, early detection and diagnosis can make all the difference. If you're experiencing these symptoms, consult a healthcare professional without delay to identify the cause and start appropriate treatment. Taking action now can safeguard your health and well-being. Sudden onset of diabetes. For many people, diabetes is a condition that develops gradually, often linked to lifestyle factors or genetics. However, when diabetes emerges suddenly and without warning, especially in someone who has had no prior issues with blood sugar, this could be a crucial sign of pancreatic cancer. What happens in the body? The pancreas plays a critical role in regulating blood sugar levels by producing insulin, the hormone that helps your body absorb glucose. When pancreatic cancer develops, the tumor can affect the pancreas' ability to produce insulin effectively, leading to the rapid onset of diabetes. This is especially concerning because diabetes that develops suddenly often progresses more quickly than typical forms of a disease. Example: consider a healthy individual in their 50s who has never been diagnosed with diabetes. Suddenly, they start experiencing symptoms like excessive thirst, frequent urination, blurred vision, and unexplained weight loss. They visit their doctor and are diagnosed with diabetes. Given the rapid onset and lack of typical risk factors such as obesity or a sedentary lifestyle, this could be an early indicator that something is wrong with the pancreas. What to do? If you or someone you know experiences sudden changes in blood sugar, such as extreme thirst, excessive urination, or blurred vision, it's important to seek medical advice immediately. This new onset of diabetes, particularly when it seems to come out of nowhere, could be a sign of pancreatic cancer affecting the pancreas' ability to produce insulin. Work with your healthcare provider to monitor blood sugar levels closely and discuss further testing if pancreatic cancer is a concern. Key takeaway: although diabetes is usually linked to lifestyle factors, a sudden onset of diabetes, especially without a history of the condition, warrants investigation into other possible causes, including pancreatic cancer. Unexplained itchy skin. Have you ever experienced intense, persistent itching with no obvious cause? It might be tempting to chalk it up to dry skin, an allergic reaction, or even stress. But when this itching becomes generalized, meaning it affects the whole body and doesn't respond to typical treatments like lotions or creams. It could be a sign of something more serious, such as pancreatic cancer. What happens in the body? In pancreatic cancer, one of the early signs can be a blockage in the bile duct caused by the tumor. This blockage disrupts the flow of bile, which is important for digestion and the removal of waste from the body. When bile cannot flow properly, it leads to a buildup of bile salts in the bloodstream. These bile salts can accumulate in the skin, causing intense, generalized itching that doesn't go away with usual remedies. Example: imagine a person who suddenly starts experiencing severe itching across their entire body, including their palms and soles of their feet. They try various over-the-counter anti-itch creams, but nothing works. This itching, known as pruritus, often occurs before more obvious signs of jaundice, such as yellowing of the skin or eyes, appear. What to do? If you're experiencing unexplained, persistent itching that doesn't seem to be relieved by standard treatments, make sure to consult your doctor. While itching can be caused by many factors, when it's accompanied by other unusual symptoms, like jaundice or digestive changes, it could indicate a blockage in the bile duct, which is often seen in pancreatic cancer. A doctor may suggest tests such as liver function tests, imaging, or a biopsy to determine the cause. Key takeaway: unexplained itchy skin that's generalized and intense should not be ignored, especially when it's accompanied by other symptoms. It could be an early warning sign that there's something wrong with your pancreas or bile duct system. Risk factors of pancreatic cancer. Pancreatic cancer is a complex disease with several risk factors that can increase your likelihood of developing it. While not everyone with these risk factors will develop pancreatic cancer, understanding them can help you make more informed lifestyle choices and recognize potential warning signs earlier. 1. Genetics and family history. Genetics plays a significant role in the development of pancreatic cancer. If you have a family history of the disease, you might be at a higher risk. Additionally, certain genetic mutations, such as those in the BRCA1 or BRCA2 genes, more commonly associated with breast cancer, can also increase the risk of pancreatic cancer. Individuals with hereditary conditions like Lynch syndrome or familial atypical multiple mole melanoma syndrome may also have an increased risk. A person with a parent or sibling who had pancreatic cancer could be more likely to develop it themselves. If multiple close relatives have had the disease, the risk is even higher, and genetic testing may be recommended. 2. Age. Pancreatic cancer is more common in individuals over the age of 65. The risk increases as you age, with the highest incidence observed in people in their 70s and 80s. Although it's rare in younger individuals, it can still occur, especially if other risk factors are present. Consider a 70-year-old man who has smoked his entire life and developed a chronic condition like diabetes. His age combined with these factors puts him at an increased risk of developing pancreatic cancer. 3. Smoking. Cigarette smoking is one of the most significant modifiable risk factors for pancreatic cancer. Smokers are 2 to 3 times more likely to develop the disease compared to non-smokers. Even after quitting, the risk can remain elevated for several years, but quitting smoking significantly reduces the risk over time. A longtime smoker who has been using tobacco for decades is at a much higher risk of pancreatic cancer than someone who has never smoked. However, the body begins to heal and reduce its cancer risk once smoking is stopped. 4. Chronic conditions, diabetes, and chronic pancreatitis. Long-standing health issues such as diabetes and chronic pancreatitis, inflammation of the pancreas, increase the risk of pancreatic cancer. Diabetes, especially if it develops suddenly or in a person who hasn't had it before, may be a sign of pancreatic dysfunction or even cancer. Chronic pancreatitis, often caused by heavy alcohol use or other factors, damages the pancreas over time and increases cancer risk. Someone who has lived with diabetes for many years or someone with a history of chronic pancreatitis may experience more severe health complications, including an increased risk of pancreatic cancer. 5. Obesity. Being overweight or obese has been linked to a higher risk of pancreatic cancer. Obesity, particularly the type that leads to excess fat around the abdomen, increases inflammation and affects hormones and insulin production. A healthy lifestyle with balanced eating and regular exercise can help reduce the risk. A person who has struggled with obesity for years and has other risk factors like smoking or diabetes may have a higher likelihood of developing pancreatic cancer. Adopting a healthier diet and engaging in regular physical activity could help reduce these risks. Chemical exposure. Exposure to certain chemicals, particularly in occupational settings, can increase the risk of pancreatic cancer. Industries like metalworking, petrochemical, and chemical production are known to expose workers to carcinogens that may contribute to pancreatic cancer. A factory worker exposed to harsh chemicals or industrial solvents over an extended period could be at risk for pancreatic cancer, especially if they have other risk factors like smoking or family history. 7. Diet. A diet high in red meat, processed foods, and sugary beverages, while low in fruits and vegetables, has been linked to a higher risk of developing pancreatic cancer. A diet rich in antioxidants, fiber, and healthy fats, such as those found in fruits, vegetables, whole grains, and fish, may help reduce the risk. A person who regularly consumes large amounts of red meat and processed snacks may increase their risk of pancreatic cancer, especially if they do not balance their diet with enough vegetables and fruits. 8. Physical inactivity. A sedentary lifestyle is another risk factor for pancreatic cancer. Lack of exercise can contribute to obesity, poor insulin sensitivity, and chronic inflammation, factors that are all associated with a higher risk of the disease. Regular physical activity, even simple walking or light exercise, can help reduce the chances of pancreatic cancer by improving overall health and maintaining a healthy weight. A person who leads a mostly inactive lifestyle and spends a lot of time sitting may be at an increased risk of developing pancreatic cancer. Engaging in more physical activity like walking, swimming, or cycling can help combat this risk. Chronic infection or inflammation of the pancreas. Long-term inflammation in the pancreas, often due to conditions like pancreatic cysts, pancreatic cancer, or infections, may increase the risk of developing pancreatic cancer. Chronic inflammation damages the tissue of the pancreas and can lead to cancer over time. A person with pancreatic cysts or recurrent episodes of inflammation due to chronic pancreatitis could be at higher risk. Proper medical management and treatment of these conditions are important in reducing this risk. These are just some of the key risk factors associated with pancreatic cancer. While we can't change our genetics or age, understanding and managing modifiable factors like smoking, obesity, and chronic health conditions can significantly reduce the chances of developing pancreatic cancer. Pancreatic cancer is a silent killer, often showing few symptoms in its early stages, making it difficult to detect until it has reached an advanced stage. However, by being aware of the warning signs such as unexplained weight loss, jaundice, persistent nausea, or sudden onset of diabetes, you can stay vigilant and seek early medical advice. Understanding the risk factors, like family history, smoking, obesity, and chronic conditions, can also empower you to make lifestyle changes that could reduce your risk. While early detection is crucial, prevention plays a major role in keeping this deadly disease at bay. By adopting a healthy diet, quitting smoking, staying active, and managing chronic health conditions, you can significantly lower your risk of pancreatic cancer. If you or someone you know is experiencing any of the symptoms or has concerns about pancreatic cancer, don't hesitate to consult a healthcare professional for further evaluation. Early intervention can make a world of difference in fighting this aggressive disease.